It is fall, which also means it's also vaccination season.
Let's get over to Dina Kupfer, standing by with an expert. Dina, learning what you can do to stay healthy, something we all want to know.
Yes, of course, and it is the season. I know everyone's starting with fall, y'all, but it's fall. Ew, sicknesses in our household especially. Dr. Dean Blumberg with UC Davis Health is with us. Good morning to you.
Good morning.
You walked in on a day full of shenanigans.
I did.
You did.
Yes.
Okay, so first of all, there's some new information we want to make sure our viewers are learning this year, and that starts with the RSV vaccine in young babies. So what's different this year?
Well, it just came out last year, just early in the fall, and so a lot of doctors' offices didn't have the supply and people were still getting used to it. So this will be the first full season that the RSV vaccine is available. And that's so important for young children because between 1% and 3% of 1 to 2-year-olds are hospitalized every year for RSV. And this vaccine prevents about 80% of those hospitalizations.
And I can attest to that. Our daughter had never been sick, and then once she hit her first birthday, she got sick, and we got her tested, and it was RSV. So this vaccine will be available for what age group?
So it's for kids who are less than 8 months of age during the RSV season, which is between October 1st and March 31st.
Okay, perfect. And let's talk about just the different sicknesses, the different illnesses. I know for me, myself, it's hard to sometimes get a doctor to give you a diagnosis at a young age for your toddlers if they get sick. Why is that, and does it matter if we know if it's COVID, RSV, or the flu?
A lot of times it doesn't matter because the treatment is supportive. So we're just going to make sure that they don't get dehydrated, get plenty of fluids, keep the fever down if that keeps them more comfortable.
Right.
However, for some of the illnesses, we do have specific treatments. So for example, for influenza or for COVID, we have antivirals. And so for those, it might be important to make that diagnosis early so we can give specific treatment.
So should you advocate for yourself when you're at the office? If the doctor says, oh, well, we don't normally test for RSV, should you still ask for it?
I think if you're interested in getting antiviral treatment in case it is influenza or COVID, then it's important to test. And for RSV, if kids do end up in the hospital, we usually do test because that helps us know what the course of the illness will be, how long they'll be ill.
And what are the big differences? I know the early onset stages of all these illnesses can sometimes on face value look similar, but they do have some distinctions.
Yeah, so RSV is really known for having a really profuse runny nose, a lot of sneezing, and maybe itchy eyes, whereas something like influenza generally has a higher fever and sometimes has stomach aches too. So they're all a little bit different.
Okay, I've always heard the myth, let a fever ride. Sometimes that's the best way for your child maybe to combat the illness. Is that true?
I think it's fine for kids to have fevers as long as they're comfortable. If they're uncomfortable with the fever, then you can make them more comfortable with antipyretics, with Tylenol or Motrin or other antipyretics. But otherwise, a higher fever actually helps them fight off the infection.
Now, is that true in the really tiny, tiny infants as well, or more in the older kids?
You know, for the young infants, for those less than 2 months of age, if they have a fever, you're going to call your doctor because that could indicate something more serious.
Okay, and then of course another season of having COVID added to the list of things that you can get vaccinated against. What is the right time frame to get these vaccines, and can you pair it with the flu vaccine?
You can get the vaccines at the same time, and you know, now's a good time to get vaccinated, or you could wait another couple weeks. It just depends. You know, the vaccines, both the COVID and flu vaccines, work for about 4 to 6 months.
Okay.
So you don't want to be vaccinated too early, but then again, you don't want to wait and try to time it perfectly because by that time you might just get infected. You might have missed your chance to prevent it.
And we don't always bring Tracy Humphrey into the equation, but she's talking about triple-digit heat. So should we be, I know it's not top of mind to think about flu vaccines now, so you said wait a couple weeks and you should be okay.
I think it's okay if you get vaccinated by mid-October for most people, even late October, and anytime during the season if you're not vaccinated, it's good to get caught up because you never know when you might get exposed and infected.
Wonderful information. Dr. Blumberg, thank you so much for being with us today.
Thank you.
Okay, stay safe and healthy and wash the hands, of course, right?
Yes,
Happy
please.
birthday twice. That's the big key. All right, back to you guys.
Thank you, Dina.